Hi, my name is Lauren. Today we're going to be discussing the topic of gender affirming care and how I believe that to be crucial for all individuals, regardless of age. And yes, that includes those that are under the age of 18. I have several reasons why I believe that to be essential. And those three reasons are how it improves the quality of life, how it reduces the suicide rate, as well as reducing depression, and how low the percentage of people that are given gender affirming care actually regret receiving the gender affirming care. I find gender affirming care to be very crucial for a good quality of life and health for many reasons, and one of those is it relieves gender dysphoria, which is the dissatisfaction you have within yourself in regards to your sex assigned at birth. Being on hormone replacement therapy gives you a boost of confidence, and it helps allow you to feel comfortable within your own body, as well as does receiving gender affirming surgeries. I know, at least for me in my own situation as a trans individual, that I've been on hormones for over 11 years, and I've also received multiple gender affirming surgeries that my insurance has helped pay for, has made a huge difference in my own confidence and my own self-worth. And I'm very thankful that I was able to receive such care. I know there are a lot of people that live in a lot of states that have very limited access to such, but I've had very good luck in the state of Michigan, and I hope going forward that we will see a change in gender affirming care. And I think there's a reason why we don't offer much gender affirming care in our country. It's because there's just a lack of knowledge. I know right now with our current political climate, there's been a lot of harm to my community, and I'm sure that we will see a increase in suicide and depression rates as laws and regulations have been introduced in all across the country that will affect trans youth as well as trans adults. Transgender individual people just want to be seen and want to feel relief within themselves, to be able to be themselves and be comfortable to be able to go into a psychologist, a doctor, a surgeon, and be able to get the care that everybody wants or needs in order to feel good about themselves. Gender affirming care, like I said, is going to help reduce suicides and depression, and having access to hormones as well as receiving gender affirming surgeries reduces these rates. 60% of people that get gender affirming care, there's a 60% reduction of depression from people that receive gender affirming care, and there is a 73% reduction in suicide rates as well. There's currently a low number of doctors or trained professionals that help LGBTQIA individuals, and a 2021 survey showed that there was only 40% of, or more than 40% of doctors, that feel uncomfortable seeing trans patients or are untrained. Now, to me, that's almost half of the doctors that are in this country feel uncomfortable or unsure how to treat a trans patient. Like I said, everybody just wants to feel seen. Everybody wants to be able to talk to a medical professional about how they're feeling, and the lack of training and education that is going on in our medical schools is an indication that, we need change. Contrary to many people's beliefs, too, the rate of regret for trans individuals after receiving either gender affirming care or gender affirming surgeries is only actually 1%. I'm not sure if any of you knew, but 12% of people regret a tattoo, 20% of people regret a knee replacement, 21% of people regret a spinal surgery, 14% of people regret all surgery, 10% of people regret having kids, and 52% of people regret student loans. 1% of trans people regret transitioning and receiving gender affirming care. These are facts. These are things that are in written knowledge that you can find on the internet that prove that the percentage of people that regret gender transition, including trans youth, is less than 2%. The research that I had done shows that only 2% of trans kids that receive gender affirming care before the age of 18 do not continue hormone replacement therapy or go on to have gender affirming surgery. I think if people had more knowledge on the topic and understood what it comes down to and the statistics and all the science behind it, that we would be seeing more gender affirming care options across the country. And I think going forward, we are taking a couple steps back, but eventually we'll be building towards a better future. I just wanted to thank everybody for taking the time to listen to my perspective and learn a little bit more about gender affirming care and how I think it helps improve quality of life, reduces the suicide rate, as well as how low the percentage of regret that trans people have getting gender affirming care. Thank you so much.